Amar's already told you the title of my talk. It's the ROC meeting, Arthroplasty in India and Unsolved Problems. And you might think those are three totally different topics, but I'm going to try to tie them together for you in a way that I hope you will find interesting and meaningful. My disclosures that I receive royalties from DePuy on some hip and knee products, and my other leadership disclosures are listed here. Now, some of you know this, many of you probably don't, that I spent much of my childhood, or part of my childhood, growing up in India. And it's been interesting to me, as I grew up, to watch India grow up over the same last 50 or 60 years. It's a picture of me as a kid, not too far from here. But what I want to talk about today is not my growing up, not India growing up, but rather Indian orthopedics growing up, and specifically joint arthroplasty growing up in India. And I want to talk with you for a few minutes about how that's happened, why it's important, and what it might mean for the future. You've heard this during this meeting several times, so of course I'm not the first one to tell you this, but it's important to point out that this meeting has been held in India yearly for the last 20 years. That's no small accomplishment. And a few of you have been here for all of these meetings, and a few of you have been here for most of the meetings. Many of you probably are newcomers to the meeting. But what I'd like to do with you for a couple of minutes is reflect together on where Indian arthroplasty has come in the last 20 years of time. Reflect with me 20 years ago when this first meeting was being given. Joint replacement in India was just getting started. There were very few procedures being done. 20 years ago, the technology available here was mostly, honestly, pretty rudimentary. And the techniques and implants at the time were decades behind where they were in the West at the same time. There were only a handful of surgeons in India who really had expertise in joint arthroplasty 20 years ago. And it's fair to say that state-of-the-art information coming from Europe and North America filtered rather slowly to India. The internet wasn't a big thing, there weren't easy means of communication, and so the data came slowly by the few people that went away and did fellowships, for example. And it's also fair to say it was mainly a unidirectional flow of information. It was coming from the West to India, and very limited amounts of information were coming from India to the West. That was 20 years ago. Consider where we are now. You know it. You're proof of it. Joint replacement is booming in India. There's somewhere around 300 or 400,000 joint replacements done per year in India now. I tried to figure out exactly how many, and I couldn't, but for sure it's growing fast. And it's also fair to say that you, as surgeons in India, have access to similar technology and implants compared to the West. All the radiographs I've seen in the last couple of days prove that. It's amazing how fast that's happened. Even 5 years ago, that wasn't so true. There's almost no lag time now, or only modest lag time, between when I can get an implant at the Mayo Clinic in North America and when you can get the implant here in Pune. And it's also fair to say that now there are many hundreds, probably thousands, of Indian surgeons performing joint replacement on an absolutely regular basis. And just as importantly, maybe even more importantly, and you've seen it the last few days, proof of it, there are dozens of experts on joint replacement from India now, and some of them are true international thought leaders, respected by all the other international thought leaders in the world. Pictures of a few of them right here, but not all of them, of course. So you might ask yourself, how did we get here, and how did this happen so abruptly and so fast? Partly, of course, it was a natural consequence of worldwide dissemination of a new technology that's a great technology and changes people's lives. I don't have to tell you that joint replacement's a fabulous technology. It's been called the operation of the century, that is hip replacement. And there's a huge need for joint replacement in India, both hip and knee arthroplasty. We all know that. A huge untapped need, by the way, that's starting to be satiated now. And you also know there are other reasons why joint arthroplasty flourished. The Indian economy has made unbelievable strides in the last several decades, which has allowed your society to afford joint arthroplasty on a much broader basis. And of course, it's also allowed all of you to train in joint arthroplasty because there's more money in the system, allows people to get the type of prolonged education that's needed to become a joint arthroplasty expert. But I would put to you that those points that I've just brought up alone do not fully explain how fast joint arthroplasty has grown and matured in India, because that's not been the case in many other developing countries. So there had to be other factors. I want to tell you what I think the other key factors have been. First and foremost, I would say that this very meeting that you're attending, and it's been held the last 20 years, has been a huge catalyst in the process of bringing joint replacement so quickly and so thoroughly to the subcontinent. This joint arthroplasty conference really has spread information at an incredibly rapid rate. It's held every year, and hundreds and thousands of you have come to this meeting. You've learned from it. It's helped build interest in arthroplasty in India, no question about it. And furthermore, and maybe importantly, just as importantly, maybe even more importantly, it's provided an annual gathering point for you as Indian surgeons to network among yourselves and also to network and rub shoulders with international thought leaders. Consider what's happened to this meeting in the last 20 years. I'm told that the first meeting in Goa, I wasn't there, had around 200 or 300 participants. Now there are over 1,500 registrants at this meeting this year. Over the years, there have been over several dozen international experts that have come and participated in the meeting, shared their knowledge with you, and you've shared your knowledge with them. And of course, all of you know this, but there have been a lot of fellows trained by the Ranawat Orthopaedic Center, at least 60 trained so far and counting. But there's another important catalyst. I want to talk to you about that. You were the beneficiary of having a person from your country who is a charismatic, altruistic, international leader and a champion from India. You know who that was? It's Chit, of course. Here he is, making one of his points. Let's give him a hand. I suspect he was actually saying there are three things, which is what those of you who know him well know he used to like to say. Now, Chit's not with us at this meeting. It pains me. I actually choked up a minute when I realized that. But I will tell you that I put a few pictures together, which I'm just going to show you without saying anything, so you can think about the effect he's had on this meeting over the years. Now, of course, Chit wasn't the only catalyst, and I think we have to recognize the role that Amar and Anil are playing currently. They played a big role in carrying on both the traditions as well as the seriousness with which this meeting is taken by all of you. There have been others. Anil's not here, unfortunately. I think he's gone. Parag has been here as an indefatigable person, always available, always watching the details, always taking care of the organization, an amazing leader who's really taken it upon himself to make sure this thing functioned and worked well. Parag, my hat's off to you. And there's a few people I want to mention who you might say have been so humble that they've a little bit hidden in the background, but we should recognize them. One person we already clapped for, Les Jacobs. Les is hiding here. Les, always here, always working hard, always doing great things. Samar Vijay Singh, a relative of Chit, Amar, and Anil. I don't know if Samar Vijay Singh's here or if he's hiding somewhere, but if he's not, we should all thank him when you see him next. And lastly, I want to recognize somebody who I bet you might not have thought of recognizing, but we should. Anand Peter, he's right over there. That guy has been unbelievable. And the amazing high-quality presentations you get that are seamless and flawless and perform on time are because he and his team are so excellent. They're some of the best in the world. You should know that. Of course, there are many others. Many of you are sitting in the audience. I'm sorry I can't recognize every single person that's been involved. You know many of the others that have been, and all of them have done a great job. But also, I want to thank and recognize you as the audience and as Indian surgeons. Why? Indian surgeons, from my experience traveling all around the world giving talks in dozens of different countries, are different. Why are you different? Because you're especially curious, you're industrious, you're creative, ambitious in the best sense of the word, enthusiastic, and engaged. There's nowhere in the world I go as a speaker where more people come up to me and want to ask good questions. It's an amazing thing to see. It's an amazing thing to be part of. Now, I want to transition and talk to you for a minute about the future. This is something you may not have thought of, but this is true. You and your colleagues in Asia are on path to do more joint arthroplasties per year than are done in North America and Europe. Think about that. It's going to happen pretty soon, actually. It's happening very fast. And with that amazing opportunity comes both opportunity as well as challenges. And what I'm going to put to you now is also responsibility. So my plea and my challenge to you as you become world leaders, which you will, is to dedicate some of the resources, wealth, and knowledge that comes from all that activity, put it back, pay it forward, put it into making the treatment of our patients better. You should engage actively in good research, in good education, and continue to try to find ways to improve the treatment of our patients. The mantle's going to fall on you. And as it does, I would urge you to study not only generic arthroplasty questions that I can study in my hospital, Amar can study in his hospital, Thorsten can study in his hospital. Instead, focus on some questions that uniquely affect Indian patients and where you have special expertise. Nobody else can do it, and nobody else will do it unless you do it. Beyond that, one more thing that I really want to emphasize to you, choose important questions to study, not just easy or trendy ones. And by that I mean choose unsolved problems where a change makes a big difference to patients. Let me explain to you what I mean by that. You could choose to study robots. Lots of interest, it's trendy, but what I will tell you is that if you do that, the contributions you make will be marginal gains compared to current technology, because current technology is already pretty good without the robot. So can you make a little bit of an improvement? Sure. Will it be a big improvement that changes lives completely compared to what it would be without the robot? No. So try to choose topics where you could make a big difference. So let me ask you this question. What if instead you choose to work on the biggest unsolved problem in joint arthroplasty? What is that? Anybody know? Of course, it's infection. You guys know that. Why is that the unsolved problem? Infection is the unsolved problem because we have made no progress on infection in the last 30 years. Almost every other part of arthroplasty has had tremendous progress, and much of the other problems in arthroplasty are solved, but that's not true of infection. The rate of infection in primary hip and knee replacement is roughly the same as in 1990. We've made no progress on prevention, despite patient optimization, staff screening, lavages, spacers, new antibiotic treatments, et cetera, et cetera, et cetera. We've made no progress on prevention. We're fiddling around with the little things we've done so far. And even worse, we've also made no progress on treatment. The rate of success of treating infected hip and knee arthroplasty is roughly unchanged over the last 30 years. And worse, the treatments we use of most PGAIs, whether they're one stage, two stages, or DARES, are either barbaric and archaic or ineffective. And when I say barbaric or archaic, I mean, think about what we're doing when we tear out well-fixed, otherwise functional implants from the bone in the name of trying to solve the problem. Take this patient I treated a couple of years ago. He was referred in with bilateral infected hip replacements. In one setting, we had to go in, do extended osteotomies on both sides, take out both implants, put in these spacers, and the guy's only halfway towards the solution to his problem. We still got to go back, put in another set of implants. And too often when somebody tears out well-fixed implants, it goes from what it looks like on the left to what it looks like on your right. What happened there? I have no idea, but it's a disaster. You all know that. So we need game changers. We need game changers to prevent infection, that is, prevent the bacterial colonization of implants, and we need game changers to get rid of established bacterial infection of prostheses. Solving the infection problem would be an actual game changer if we could do it. It would help tens of thousands of patients. So think about trying to solve the world's unsolved problems, not the world's solved problems. And while I chose to highlight infection, of course there are lots of other unsolved problems. So if you choose real problems that affect many patients and currently have no good answers, that is where you can have the most lasting impact. So my challenge to you as I close is, number one, bask in your amazing progress over the last 20 years. You should be proud of it. Number two, continue to consolidate and disseminate that progress around your country. I'm sure there's corners of the country that still need more help. And finally, as you assume and grow into the mantle of leadership in arthroplasty, which you will, try to choose real unsolved problems to work on. And if you do that, you can, and I predict you will, become world leaders in arthroplasty. Ladies and gentlemen, thank you so much for the kindness that you've given me over the years, the privilege of participating in your meeting. I wish you well with the coming year and hope I have the chance to come back and join you in the future.